Hey guys, it's Erin Hennessey from Blush Aesthetics. Today I want to talk about smile lines. So someone recently posted in our community page asking about smile line filler or smile line solutions. And we get this question a lot, so I thought it is definitely worth making a video about. So one of the things that people come in and say is, I have deep smile lines here and here. And these are also called nasolabial folds. Sometimes if they go all the way down past that outer canthus of the mouth, then they become marionette lines in that area. So you'll hear them called marionette lines, smile lines. Some people call smile lines these little crinkly guys that happen when we smile. So depending on what you categorize, what we're really talking about right here is this nasolabial fold today. So depending on your anatomy, depending on the amount of volume loss you have, maybe it's been weight loss, bone loss, which really starts more in like our 20s and 30s. We don't see it necessarily until our late 30s, early 40s. Sometimes we're starting to see that. People will notice that kind of this cheek area may be getting flatter, may not be as round and curved as it was when you were younger, but also this fold right here can get a little bit kind of moved in on itself and make a deeper line. I'm sorry, I'm using my face as an example. I naturally have deep nasolabial folds, right? So when I kind of go like this, you can see that fold decrease. So for some people with certain anatomy, the right solution is a facelift in that area, especially if it is somebody of more advanced age. For some individuals, a little bit of filler in that area is a wonderful Band-Aid solution for a while. And for some individuals, we really need to work on the cheek because that fold is a natural sequela of volume loss in the cheek. Okay, so when it comes to choosing kind of which route to take, the best thing you can do is have a consultation with an experienced injector, someone who can give you some ideas of, okay, this is going to give you this percentage of improvement, this will give you this percentage of improvement, but also someone who has a good amount of experience in injecting that area because it is a little bit of a tricky kind of sticky wicket as far as areas go in injecting. Here's the reason why. There is a tortuous vessel called your angular artery that runs down in this area at varying depths. Because we don't have necessarily x-ray on the skin, we don't know how deep that is. And so when you're injecting, you need to be able to identify kind of what area and what depth of skin you're in to try to stay as safe as possible. Even the best injectors are occasionally going to have an issue in that area where they may or may not have some of that artery that they have gone past that they could have injected into. So you want someone who has some experience, A, in injecting, B, in having a complication and being able to also dissolve what they've put in that area to bring blood flow back into that area. So you can see how it can become just a little bit more risky. It's just a more advanced area to inject, if that makes sense. So if you have gone to your consultation and you have talked to the medical professional, which really should be an RN or an NP, an MD-DO, kind of injecting that area, and they say, yes, you're a good candidate for this. You can kind of yourself even kind of pull up a little bit on that area and see what that would look like and then smile. I want you to like what it looks like when you smile when that area is flat. Because when we're not addressing any other volume loss on the face, when we're not doing things like Sculptra to help build that good collagen in the skin, when we're just kind of fixing one area, sometimes it can look beautiful for the right person with the right anatomy, and sometimes it can look a little strange, a little flat, and change actually the way your cheeks act when you smile. And so I just want to make sure that I arm you with the questions that you need to be an informed consumer, no matter where you are and who you're going to. So one of the first questions that you want to ask is, how long have you been injecting these types of materials into the face, whether that's PRF, whether that's filler? Ask what type of filler they like to use best, what works well in their hand. It's harder for us in the Midwest to get folks that are willing to share their pictures because a lot of the patients that we have don't want anyone knowing that they're doing these types of procedures. They want it to be their best kept secret, and we also want to make sure that we protect that privacy as well. So some people will have more pictures than others to show, but really the anatomical evaluation is super important. So you want to know, where did they have training? Where did they come from? Did they just take a weekend class and you're one of their first patients, or have they been injecting for a while? Did they come from a plastic surgery dermatology background? Did they come from a background maybe in neurology, in emergency medicine, in vascular? I mean, those are all great areas to start in before moving into aesthetics. And so they will have a little bit more of a background experience in working with faces. And it's your face, so it's really important that you get these questions answered. Second question I really like for everyone to ask is, are you board certified? Board certification becomes really important in these things. You want a board certified nurse practitioner, that you're seeing a board certified surgeon in plastics and dermatology that is looking at your skin, that is evaluating you, that is determining the right product, the right procedure, and who can do it safely. So all very, very important factors. The third thing that you may want to ask is, what happens if I have a complication? How do I get a hold of the office? What are some possible medications that I will have to invest in further to make sure that we can fix this? Or is that something that the office covers for you? So you want to ask about complications, because we're all human out here and complications do happen. And so you just want to make sure that they have the tools that they need there in the office and the knowledge and the experience to be able to help you if something were to happen. The next thing that you should ask is the timeline of healing. So typically for most folks, we're going to say you're probably going to bruise. Anytime we're putting a needle into the skin, you have the opportunity for bruising. So you want to do these types of procedures 6 to 8 weeks before a special event so that you're not swollen, you're not bruised, your skin looks good, everything has settled, and you have the optimal kind of result that you're looking for. So in sum, make sure that you're asking all of the questions about experience, about products. If the price seems like it's too good to be true, or it's a Groupon special, you might want to stay away from that. There are counterfeit products out there, or there are providers that are brand new to this and are pricing it, and you don't know that they're your guinea pig. You don't want to be that for somebody unless you really understand and accept that risk. So if you have any questions, please reach out. I'm always happy to help anyone kind of move along the way. Here in this industry, we all work together. We want to make sure that patients get wonderful outcomes, but that we also minimize risks. If you're interested in smile line treatments, we have lots of different choices. We'd love to see you at Blush Aesthetics. Come on over and see us. Blush Aesthetics is at blushnwo.com.